Good morning. It's 9:30. It's our scheduled Saturday morning yoga therapy class through Satyik Space, Yoga and Healing Studio, a non-profit community yoga and Ayurveda center to improve the health and healing of our community. And we, a lot of our teachers, we provide our selfless service for that center. And if you're following them through your Facebook Live page, please try to make a little voluntary donation for them. At this time, they need all the support. Today's topic is yoga therapy for gastrointestinal disorder and the concept of yogic diet. In yoga therapy, the main function of our body is our digestion of the food we take. As you know, yoga and Ayurveda comes from the same source called in Veda, and we describe them together. Let me just make a little adjustment here so you can see it better. Okay, so it is actually, we call it in West, we call it a sister science, but this is not a sister science. It's the same source. And the concept of the class is the name of my book. And many of you have seen my book. It's called the Yoga Therapy, Ayurveda, and Western Medicine. They call it Healthy Convergence. It's a picture of Albert Einstein and a Rabindranath Tagore. Albert Einstein is a scientist. Rabindranath Tagore is a philosopher. We said when a science meets a philosophy, it's a yoga therapy. In our Western concept, our whole gastrointestinal system is the second brain. It is connected to our brain. It produces the same neurotransmitters as the brain produces. In fact, because of its size, it produces more neurotransmitter than the brain. And it is connected to our mind. We use the term all the time, that gut feeling, our gut feels. And the gut, what we talk about, it starts from your mouth until to your end, which is your anal sphincter. From the mouth, you can see that all the salivary gland, primarily the parotid gland, which secretes the saliva. Then the food gets masticated, like you chew the food and chew enough. And we'll talk about these concepts. The Yoga and Ayurveda says you chew it enough that you make a solid food as a liquid, and it says that you drink solid. Then when we say drink liquid, he said, no, don't drink liquid, you eat liquid. You have a liquid, put it in your mouth, enjoy the taste of it, sense of it, then it's swallow. So the term we use called drink solid, eat liquid. It goes down through a tube or a pipe or esophagus, comes to the stomach, which is your reservoir for your digestion. All the enzyme comes. It's like your washing machine. In yoga therapy, it says you have to keep 1/3 full, 1/3 with the water, 1/3 empty, so you can turn like a washing machine to start the digestive process. Then it passes through your a C type of tubes called the duodenum, where the pancreatic juice comes and starts digesting. goes through a long tube, almost 20 feet, called small intestine. Then the residual, where all the absorption takes place, and the residual comes to your colon, where it gets stored as a fecal material, and it's come out through the anal sphincter as your stool. The whole gastrointestinal tract is supplied by parasympathetic nerve. So the outcome of yoga therapy is a relaxation response and activation of parasympathetic tone. So it is a therapy primarily for your gastrointestinal tract. In yoga therapy, food is not a calorie. Food you don't burn with the exercise. Exercise is sympathetic. Exercise in a muscle contraction, your heart rate goes up, blood pressure goes up, respiratory rate goes high up. So it is counteracting the parasympathetic tone. Food is not properly digested, and the undigested food becomes our toxic material. In Ayurveda, it's called the ama. In Western medicine, we call it high cholesterol, high fat, high sugar. Anything high in our blood is called the toxic substance called ama. In yogic and Ayurvedic tradition, when you consume a food, the food gets converted into your body tissues. They call it sapta dhatu, 7 tissues. The digestive process in yoga and Ayurveda also is a very subtle process where body uses all the 5 senses, pancha indriyo. We hear the sound of food, called sizzling. We see how beautifully you serve. That's what the chef does, a beautiful presentation. You smell the food. You taste. Ayurveda says there is 6 tastes: astringent, bitter, pungent, salty, sour, sweet. In West, we have 4 tastes only: bitter, salty, sour, sweet. Ayurveda has 2 different tastes called astringent and pungent. Then for the touch, in yogic tradition and also in Indian tradition, you use the hand to eat the food. And how you eat the food, it starts your digestion. So mudras are a part of your yoga therapy tradition. So let me first start with a hand mudra for digestion. Then we'll go for the asanas for your digestion, pranayama for your digestion, meditation for your digestion. Then at the end we'll discuss more about the concept of yogic diet. So in a hand, there are 4 mudras by which you eat your food. When you take your food with your hand and then use your thumb to push the food in your mouth, this is called a anno bhakha mudra. Anno means food, bhakha means eating. Anno bhakha mudra. It creates another sense of your digestion. Remember, mudras are the neurophysical connector of your body and mind. So remember that the gastrointestinal tract is your second mind. It starts anno bhakha mudra. Next one is you put your foods in the 4 fingers, leave your little finger out, and in yogic tradition it's called the keni anguli. Keni means small, anguli is your finger. This is called keni anguli mudra. You take the food, and different foods you eat in this way. You take this one, anno bhakha mudra. This is called keni anguli mudra. You can hold a food with your all the hands and then eat. Like you're eating an apple. You hold the apple and eat. This is called a Kadamba Mudra. Kadamba Mudra, this is also helps in your digestive process. Then you can use all the 5 fingers, take a food and put it in your mouth. This is called a Mukul Mudra. Mukul Mudra. Annabhakya Mudra, Keni Anguli Mudra, Kadamba Mudra, and your Mukul Mudra. So practice this. Practice this even if you're using a knife and a fork. You can use this hand gesture, which will help your digestion. Next, the practice we do is called your Udar Karshan. Udar Karshan means, Udar means your stomach, Karshan means your massaging. When you do Udar Karshan, we'll show it to you, called your Mundukasana, frog pose. You'll be massaging your abdominal content. Kapal Bhati Pranayama. So if you're a yoga teacher who is listening to me, remember this. Mundukasana, Kapal Bhati Pranayama. Kapal Bhati Pranayama massages all the internal organs. Your Uddiyani Bandh, abdominal lock, which increases the negative intra-abdominal pressure and helps in proper perfusion of the organ. As I said, I teach all the healthcare providers, physicians, and other healthcare providers, so I give them the explanation how this thing works. Then Agnisar Kriya. Agnisar Kriya, you are massaging all the organs. But this is for the yoga teachers. You need to understand that when you do this without a relaxation response, without quieting your mind, this thing doesn't work. So what you need to do, you need to practice a relaxation response first. And we'll do that. We'll do relaxation response. Next, you bring the vagal nerve activation. Why? Vagal nerve or vagus nerve supplies the whole gastrointestinal tract. Can I already describe one session how to activate the branches of the vagus nerve starting from a ear, called auricular branch of your vagus nerve. Then comes your laryngeal and pharyngeal sphincters, like a Valsalva maneuver, Corno-Rogantok Pranayama, opening the eustachian tube to the middle ear, your Ujjayi Pranayama, massaging the carotid sinuses with the massaging your neck. Then you do your Jalandhar Bandha, chin lock, and most powerful relaxation is called your Jalandhar Bandha with Abhantarin Kumbhak. Breath holding in inhalation is called your Mucha Pranayama. Mucha Pranayama means unconscious pranayama. You do also through your lung. When you start slowly, you call it breath holding, your lung starts to get expands and expands more. Then it's called a herring-brewer reflex. When herring-brewer reflex sets in, your lung cannot expand anymore. At the time, vagal nerve activation comes in, and vagus nerves get activated, and the lung has an exhalation. You have the anterior and posterior vagus nerve, which was in front of your gastroesophageal junction, one in front and one behind, and Kapal Bhati Pranayama massages that. Able to bear down, like you're bear down, trying to have a bowel movement, is also a vagal nerve activation. Able to sit down in your squatting pose. And you will see in yogic tradition, you do a ushapan, drink water first thing in the morning, sitting in a squatting pose, and then you also have a elimination in squatting pose. And these days we have a squatty potty, and I'll show it to you how to do it. So let's go ahead and start the practice. The practice session will first start with how to start a relaxation response. In a relaxation response, the first component is Manasthir and Merudanda Achal. Manasthir means you quiet down your mind. Merudanda Achal means you sit down with your spine straight. So if you're able to sit down in a ground where I'm sitting, you can sit down with your spine straight with a nice asana. It's called the Sukhasana. Take your feet, put it underneath your knees, and you cross in the middle and keep your spine straight. Many of people who are watching me now in live, they calls me and they also sends me a message, I cannot sit down in the ground. You don't have to. You sit down in a chair, and I have shown you multiple times how to do it. Sit down in a chair, go all the way to the back, keep your spine straight. Your body will be like a 90-degree angle. If you sit down, what happens, the muscles in the back, called paraspinal muscles, which are tight, which keeps me up straight, the paraspinal muscle starts to relax, and you feel the effect of this relaxation response. Next, as I said, our hand, I describe called your digestion mudras. Hand is a neurophysical connector to connect your body and mind. And you all know that we all talk by hand. When you're talking, we're moving our hands. So, the hand moves before even our word comes out in our mouth. Hand represents the whole universe, space, air, fire, water, earth. These are all in my the session before is called your mudras and acupressure. And all of them, my sessions are recorded in Facebook Live and also in the YouTube in my channel, and you can go back and see all of them. The powerful mudra is called Gana Mudra or Dhyana Mudra, touching index finger and thumb. And when you look at my session on the mudras, you will know that how it affects. Put it gently over your knees. Then your 5 senses. The 5 senses keeps you awake, alert, and conscious, like your hearing, vision, smell, taste, and touch. You shut down your 5 senses. That is called the 5th limb of Ashtanga Yoga, 8 limbs of yoga. Yam, Niyam, Asana, Pranayam, Pratyahara. Pratyahara. Pratya means reject, and ahar means input or intake. Intake is not only through your stomach, intake is through all of your 5 senses. And our brain is in a state of vibration, your body is in a state of vibration. We know that. We record called EEG, electroencephalogram, EKG, EMG, in electrocardiogram, electromyogram. We see all the spikes. This is nothing but a vibration. So you create a vibration from outside, and 2 vibration interacts, cancels, it quiets down your mind. That is called your Bumblebee Pranayama, bumblebee breathing. Let's practice 2 or 3 bumblebee breathing. Then we'll do your little bit of a breathing, because inhalation is sympathetic, exhalation is parasympathetic. We'll do effortless, longer exhalation than inhalation, and they will continue the therapy for your gastrointestinal system. And this is, I'm emphasizing more and more for the yoga teacher. Please don't start with your Mandukasana. Don't start with your Kapal Bhati Pranayama. Don't start with your Udyani Bandh, Agnisar Kriya. You need to give your body and mind a relaxation. Your body will be like a fluid. So many of you have done it with me before. Could do your Bhramri Pranayama, bumblebee breathing. Put your index finger on your forehead. Use the 3 fingers to close your eyes and thumb close your ear. This also can be done with a mudra called your Shammukhi Mudra, which you take the 1 finger at a time, bring it down, close your nostril and close your mouth. But this is in a nice way of doing it so that you can keep and close your mouth. So you will breathe out first, and then you will take a deep breath in and breathe out through your nose with the sound of a bee. So breathe out first. Take a deep breath in. Slowly take your both the hands. Keep rubbing your hands. Keep rubbing your hands. This is called pumping and cupping. It's a daily practice for relaxation. If you're wearing glasses, just remove your glasses. Take both the hands, make a cup, put it over your eyes. Let the eyes take all the heat from your hands. Then you massage your forehead, massage your eyes, massage your face, and primarily massage your earlobe, massage your tragus, massage your auricle. This is called your auricular branch of the vagus nerve. You are activating your vagus nerve. Bring it down, massage your neck up and down. This is called carotid sinus. The carotid sinus also increases your baroreceptor sensitivity. Massage your neck. These are the way you create a relaxation response. When you feel relaxed, you will see you have a saliva in your mouth. Saliva in your mouth looks like I have a saliva in my mouth. That means a parasympathetic activation. Then when you relax, you progress. The way you progress, you call in stages, impossible become possible. So I was sitting like this, call a Sukhasana. Then I cross my feet on the other side. See if I can sit on the other side. Because it's a balancing both sides of the brain. When your both sides of the brain is balanced between right and left brain, you're in a state of relaxation. The lateralization, I'm using one side of my brain, is creating all the problem for us. So in next progression, if you can see, if I can progress a little bit more, I can put my one foot in the top and sit down. Very nice relaxation technique is take my hand, put in between my toes. I relax my whole toes, feet, and lower extremities. Very nice way. Relaxation of the knees and hips. I hold it up, knees, breathe in, slowly let it go all the way down. You'll see this thing will happen to you and this will come to you. Instead of you trying to do it, create a relaxation response will come to you. Always go to the opposite side. This is called your Ardha Padmasana or called Swastika Asana. And I sit down here like this all the time. I'll be sitting down. And then when you create the relaxation, you will see your feet is going to come up and you will be able to sit in a Padmasana. So you are not going after Padmasana. Padmasana will come to you. Why? When you sit down in a Padmasana, lotus pose, or you sit down in a Vajrasana. We'll do it to show it to you. Vajrasana, thunderbolt. You keep your spine straight, your head connected, and then you get a profound activation of parasympathetic tone. So recommend after a meal, sit down in a thunderbolt, Vajrasana, or in a Padmasana. Say, I'm not going the Padmasana right away, which I'll be able to do it, but I'm showing it to you how to do it in stages. Let's do a little breathing. Lung is like a balloon. It has a 4-liter capacity, and we only breathe 0.5 liter, 500 cc. Actually, vital capacity is almost 4.5 liter, and residual volume is 1.5 liter, almost 6 liter lung capacity. So now what is this a balloon? You need to breathe out first. When you breathe out first, then you gently increase the amount of air you are bringing in and amount of air bringing out. All the muscles of respiration are called skeletal muscles. They're trainable. They all connect to your hand. The moment you do some hand balancing and hand strength, like a Bakasana, crow, Mayurasana, Mayuriyasana, Pongu Mayurasana, Ashtabakrasana. These are the asanas for your hand strength and hand balance. So you will be practicing with me, and we'll be practicing, say, count of, first you breathe out, then we'll do count of 2 in, count of 4 out. Count of 3 in, count of 6 out. Count of 4 in, count of 8 out. And we'll continue to progress. But for you, you do only effortlessly. The place where you cannot do anymore, you stay over there and breathe. Effortless breathing means you're able to talk, you're able to sing. Say, I'm talking on my asana. This is also another asana practice. Sthiram Sukham Asanam. Stillness, happiness in the asanas. A powerful relaxation technique is called your Balo Mushti Mudra or Adhi Mudra. It's like a baby fist. A baby will take the hand, will take the thumb inside and close. Practice. Take the thumb inside and close. By the time you're able to do it, your pain in the hands will go away. Arthritic pain will go away. If you have some physical disability, a relaxation will overcome your physical disability. I have people who had a previous stroke, previous polio, and previous lot of musculoskeletal disorders. I tell them this is a holistic approach. It is not a reductionist. Able to relax your hand, able to relax your upper part of the body, able to relax your neck, will relax your whole body and mind. A lot of other mudras, beautiful mudras, like one is a touch finger and just put it over your hands down, called a chin mudra. It opens up lower part of the lung. If you close all the fingers, it's called Chinmay Mudra. It opens the middle part of the lung. And this is called Adhi Mudra, opens upper part of the lung. Let's do the Adhi Mudra. Put it over your hand. Close your eyes. Breathe out first. And we'll continue. Count of 2 in. I may do a little bit of, just to show you the technique, count of 2 in, count of 4 in, count of 6 in, count of 8 in. We also can do almost a count of 10 in and count of 20 out. Breathe out first. Breathe in, count of 2 in, count of 4 out. Count of 4 in, count of 8 out. Count of 6 in, count of 12 out. Count of 8 in, count of 16 out. Wonderful experience. I continue. I do practice it every single day. Count of 10 in, count of 20 out. See, I'm relaxed enough. So what I do here now, I take my other foot, bring it up, sit down in a Padmasana. Hope you can see me well now. So I'm sitting in a Padmasana. I'm very well relaxed. This Padmasana is your most relaxation practice. This Padmasana is for your digestion. When you consume food, how does the yoga and Ayurveda looks at it? Ayurveda looks at the food is being consumed and digested with all the five senses in a subtle process. And food, for a scientist, converts into energy. For yoga therapist, it converts into consciousness. Food converts into 7 tissues: Rashodhatu, Raktodhatu, Mamshodhatu, Medodhatu, Astidhatu, Majjadhatu, Shukrodhatu. The first one, if you take a food, it converts into your plasma, Rashodhatu. Then it takes about 5 to 7 days. It's called an immature dhatu and a mature dhatu. Converts into red blood cell. Then converts into Mamshodhatu, is a muscle cell. Medodhatu, fatty tissue. Astidhatu, bones and joints. Majjadhatu, nervous tissues. Shukradhatu, reproductive tissue. Then it forms a substance called the ojas. Ojas is your cellular immunity. Cellular immunity is your health. We have 3 concepts in yoga: prana, teja, ojas. Prana is a subtle force which comes in through your breathing. Breathing takes the subtle force. It is your cellular communication. Tejas is it's a fire. We call it your Agni, Jathar Agni, a digestive fire in our stomach. And we'll show you how to ignite your Jathar Agni. We'll do that practice. And when you have a Tejas, Tejas is glowing. It looks like there is an aura around your face. It's called cellular intelligence. And Ojas is called your cellular immunity. Remember, the immunity comes from within after proper digestion of the food. And Yoga and Ayurveda says we are what we digest. In Western medicine, we said we are what we eat, not what we eat. If you eat is not digested, that toxic material becomes your high fat, high cholesterol, high sugar, high uric acid, name it. Anything high is a toxic material. So you need to create ojas. Another very nice, because a few of the Ayurvedic statements I want to share. Ayurveda says food is a medicine. And they says if the diet is not right, the medication doesn't work. If you're taking medication, the diet has to right for the medication to work. Then the corollary says if the diet is right, you don't need a medication. Another one, a beautiful statement, Ayurvedic statement. The mind in the state of acceptance can convert a poison into a nectar. And the mind in a state of resistance converts a nectar into a poison. You know, you're eating this cheesecake and you're thinking it's going to raise my cholesterol, raise my blood sugar, hell, it's going to raise your cholesterol, raise your blood sugar. You have this one, you're eating once a week. No, the food is a divine, it's a spiritual practice. It is a God is giving it to us. Spirituality, you take it, it'll be part of your body. The diet, what the diet comes from? That comes from the Latin word diatia or dietia. It's a way of living. That's all life is, your diet. As simple as it is. Diet which will prevent any of the disease coming to us, including the coronavirus. So the food has to be properly digested. It's okay. So in all my session, you can see how to do the neck relaxation, you know, your Paschim Namaskar, and all the activation of the vagus nerve. So you can all do it. Like you can do a Valsalva. Well, let's practice one Valsalva. Let's see how the Valsalva does to you. Valsalva is a forced exhalation with closing your mouth and nose and opening up your eustachian tube, which connects your throat to your miliar canal. So, use your left hand for relaxation, Adhi Mudra. Breathe out first. Take a deep breath in. Close your nose and mouth and starts to breathe out in forced exhalation. Wonderful practice. Western medicine we call Valsalva. In yoga therapy we call Korno Rogantok Pranayama. It's a pranayama practice where the ear gets opened up. It's very good for treatment for ear. And then we showed you the massaging your tragus, massaging your auricle, massaging this. Very nice. Huh? So see, very nice. You feel relaxed. You are in a Padmasana. And how do you show? Tulasana. Put your hand on the side. Beautifully. Press it down. Your whole body goes high up and stays high up. In stages, impossible become possible. The relaxation, impossible become possible. Okay. Next asana, which is the asana for primarily activation for your massaging your stomach. We'll do some pranayama practice and we'll show you what are the relaxation pranayamas. The most important relaxation pranayamas will be alternate nostril breathing, Anulom Vilom Pranayam. Then a meditative alternate nostril breathing, which will do the alternate nostril breathing without closing your nostril. Then we'll do your Mucha Pranayama. And okay, maybe let's do one practice of Mucha Pranayama. So you will see that you do it, even after a meal. That remember the Jalandhar Bandha, chin lock, able to touch your chin to the chest slowly. Let's practice with me. What it does, it massages the carotid sinus. Like we know as a physician, when the patient has a supraventricular tachycardia, that means heart is racing very fast, we massage these carotid sinuses. It activates your parasympathetic tone, increases your baroreceptor sensitivity. Again, relaxation always comes with your Adhi Mudra, Balo Mushti Mudra. With yoga practice, you're like a baby. We act like a baby. So what we'll do, you'll breathe out first, take a deep breath in, you'll hold the breath and slowly drop your chin down, touch your chin to the chest, and you keep on counting as long as you can hold. This will be your called Mucha Pranayama, activation of your parasympathetic tone for proper digestion of your food. Remember, all the practices we do in the stomach is your in empty stomach. In a full stomach, you cannot do the Udar Karshan, like massaging your stomach. In a full stomach, you can do called a Surya Vedi Pranayama. You breathe through your right nostril. Even the right nostril is sympathetic, but it's a heating. It's helping little digestive process because of its balancing function when the stomach is full. So let's try. Breathe out first. Take a deep breath in and hold your breath. Slowly drop your chin down. Keep your neck straight. Don't bend your neck. Slowly drop your chin down and bring your chin close to your chest and stay in this position and keep counting. See how long you can hold your breath on this Mucha Pranayama or unconscious Pranayama. Wonderful practice. We'll do Kapal Bhati Pranayama. This is also for the actually physician and healthcare provider. This is through your herring brewer reflex. If you forget your physiology, you can always check it. Guyton is a very good book, Guyton's Physiology. Most important relaxation is your Vajrasana. The way you do Vajrasana, you first start sitting on your heel. If you can, the spine straight. And then slowly and slowly, what you do, you separate your feet and sit down in between. This is the asana you do after eating a food. And I have seen our grandparents, they always sit down like this after with a full meal. And you sit down within a short time, you feel so relaxed, so comfortable. And you will see all the babies sit down like this. This is also one of our prayer poses. And many faith traditions, Judaism, even Christianity and Islam, sit down like this position, during the prayer. This is one of the sitting position for even doing your namaz, and also in a lot of other faith tradition. So relax now. Remember, this is an empty stomach. It's not a full stomach. In a full stomach, you just sit down like this. In an empty stomach, you do Mundukasana. Let me show you from the front, so you'll be able to see better how a Mundukasana is like. You're sitting in a Vajrasana. First, you use your hand. 2 steps. Put your one hand in a belly button, other hand there. So first, you, again in the all yoga tradition, you breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in a little bit. Put your hand in the belly button and slowly come down in the front. Now remember, you are breathing. You are not holding your breath. You're breathing in and out, and you're coming down. You are listening to your body. What is your body? Pain. If there is a pain, you back off. Remember, this is individual practice. You're not competing with anybody. If there is no pain, you keep on coming down, and then you listen to your breath. If your breath is not effortless, if you cannot talk, you cannot breathe, back off. Find a spot where you have no pain and effortless breathing, and you stay here between 5 to 10 breaths. But if you can keep on coming down, you just keep coming down all the way down to your ground, put your head down, and you stay here. Mundukasana, frog pose. It massages all the internal organs in your stomach. You can always do with a Adhi Mudra. Remember, the Adhi Mudra is a very relaxing asana. So take your hand, thumb inside and close. Bring it slowly close to your stomach. And people always ask me, I cannot do what you are doing. You don't have to. You start where you are. You listen to your body's signal. 2 important body signals: no pain and effortless breathing. Okay? So now again, you breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Slowly come down again, listening to your body's signal. No pain, effortless breathing. You can come all the way down, touch your head to the ground, and stay here 5 to 10 effortless breathing. I'm showing you the technique, but at home you do it a little longer and longer. Wow. See, I always get one credit from all the yoga teachers. They always, they introduce me, all big conferences, and they will first thing they say, he's the one who can even talk and sing. when he's doing his Shirshasana headstand and doing a Vajrasana. It's totally effortless practice. Wonderful relaxation is your Malasana. If you're able to sit down in a Malasana, if you prepare yourself in slowly in relaxation, you will be able to sit down in a Malasana. Like you sit down. Malasana. Mala means excreta. You are excreting. So look at this way. My ankle is relaxed, knee is relaxed, hip is relaxed, back is relaxed. Upper part, put your hands together. If you're doing with me, if you can do it, just do it. Separate your fingers, your hand gets relaxed. If you extend your wrist gets relaxed. You put your one elbow inside, other elbow inside. Slowly bring it close to you. Close your eyes. Breathe out longer than breathing in. This is the asana, is like your antivirus software for your body. No disease will come to you. You get a profound relaxation. And look what is happening here. All the pelvic sphincters, pelvic muscles are relaxed. Then we have the lower part of your rectum and anal canal, and there is a muscle called puborectalis which acts like a sling, and it causes a little kink or bend. So normally we don't have your incontinence. I'm standing up normal time, my stool doesn't come out. But in this position in Malasana, the anorectal junction straightens up. So you get a proper elimination. So this is the first thing in a yogic dinacharya, daily routine. In fact, what we do, in fact, I do all the time in practice. Let me show it to you. We drink a glass of water in the morning. It's called a ushapan. I use this is one yogic tradition called using a copper vessel. This is in the copper. Copper is used. Copper actually being used extensively now, even in the West. Copper is shown that copper has an extra electron, and it says that electron acts as a missile to hit your virus or your bacteria. In fact, my hospital system here, called a Centera healthcare system, they're using all of their coverings, bedsheet covering, every body covering, impregnated with copper. I keep a glass of water before I go to sleep on my nightstand, put a nice coaster, nice covering. It stays, and it stays in a room temperature. Then first thing when you get up, you sit down in this squatting pose, and you drink the water in a gulp. This is a yoga practice for your gastrointestinal system. Here you are sitting in a squatting position. You hold the glass, and then when you drink the water, drink in a gulp, like when you finish that, within a short time you'll see that your peristalsis has started, contraction. Then when the water goes to your stomach, it starts a reflex called a gastrocolic reflex. Stretching of the stomach starts contracting your colon. So you get a proper elimination. And that's a yogic sign. The health is defined as a strong digestion, easy elimination, and good night's sleep. So easy elimination is a part of your called Shankha Prakshalan. Shankha Prakshalan is a 5 asanas. You do it a full Shankha Prakshalan, called a Purna Shankha Prakshalan, maybe once a 6 month or once a year. That is a part of our called a Kriya. Kriya is called Sharir Shuddhi. It cleans your body. And one you call a Laghu Shankha Prakshalan. Laghu Shankha Prakshalan, we do the 5 asanas. Maybe we'll practice it today. You'll see 5 asanas. And then we do call it your Agni Deepana. You ignite your Jathar Agni, stomach. 5 or 6 asanas to Agni Deepana. Now, when you sit down like this, for a elimination, you get a very nice elimination. And remember one thing, your whole elimination should be also effortless. According to yogic tradition, constipation is the root cause for all of our ill chronic diseases. And also remember, you don't have a bowel movement first thing in the morning. Throughout the whole day, you are holding that toxic, dirty stool in your colon, and you are literally self-poisoning yourself. So the first bowel movement in the morning. And if you go to one of my session, you can see called a Dinacharya, daily routine is there. Now, and I have shown you before, maybe I can show you again one more time. If you don't have, kind of sit down like this, we Americans, very creative. We have it's called your squatty potty. I don't know how many you have seen. Squatty potty goes all around your commode. You can sit down in this position. Squatty potty comes in 2 heights, 6 inch and 9 inch, based on who you are, and then get a proper elimination. Let me see if I think I have it here. Yeah, let me show it to you how it works. This will be your squatty potty, if you can see. This is not the right thing, but in a chair. I'm just going to show you for demonstration how is, because it's very important yogic practice. And all the yoga practitioners does it all the time. When I go to India, sit here. It's a nice way of using squatty potty. I have it, I use it, very nice. Okay, then here comes the Agni, Jathar Agni, Agni Deepana. The whole yogic and Ayurvedic concept is, the 4 elements. This is primarily for the yoga teachers. When you have a proper Agni, this is called a Jathar Agni, that it will digest your food and there will be no toxic material called ama. Ama is the toxic material for improper digestion. So what it's going to do? Agni Deepana. Deepana means ignite. You ignite your Jathar Agni, so you have a proper digestion. The food converts into your Sapta Dhatu, 7 tissues, as I explained to you, and then it converts into ojas. The ojas is your cellular immunity. So then it does what is called ama pachana. Pachana means cooking, destroy. It destroys all the toxic material called ama. And the third is creates called your Nadi Shodhana. Nadi is the channel. And yogic tradition, all your prana, the life force, flows through your channel, and all the channel gets clogged and blocked by ama. Nadi Shodhana, cleansing of the channel, then called Oja Sthapana. Ojo is your immunity, Sthapana is establish. You establish your Ojo. So for the yoga teachers who are looking at me or listening to me, I have a lot of yoga teachers are following me, and as I always tell them, I love to share what I know for them to spread the word to improve the health of healing of our community. 4 concepts. Agni Deepana, Ama Pachana, ignite your Agni, destroy your Ama. Nadi Shodhana, cleans all the body channels. Ojo sthapana. Ojo is your immunity. Sthapana means establish, you create your ojo sthapana. Let's show you the 5 or 6 asanas, which is all laying down asanas to improve your Jathar Agni. One of the most important relaxation response is your abdominal breathing. So when you see a baby, baby is always relaxed. When a baby is sleeping or baby, even quiet down, you'll see the baby's belly going high up and breathing in and going down, breathing out. So let's do some abdominal breathing. And there are 5 asanas which are igniting your Jathar Agni. These are the asanas for your gastrointestinal disorders. Remember one thing, just I want to share with you, it's a very important concept. In gastrointestinal system, this especially for physicians also, we have about basically 3 diseases. Disease. First is a tumor, and it could be benign or malignant. It's a growth in gastrointestinal system. Second is inflammation, ulcerative colitis, inflammation, Crohn's disease, and many of them we think it's from autoimmune disorder. Then it comes your ulcer, peptic ulcer disease, which you used to think of as stress, now we know is called H. pylori from a bacterial infection. And then the rest of all the gastrointestinal disease, we try to justify. Like irritable bowel syndrome, IBS, gastroesophageal reflux, your celiac disease, say gluten sensitivity. But for a yoga therapist, they're all called functional gastrointestinal disorder. And functional gastrointestinal disorder improves with the activation of parasympathetic tone. So if you can lay down, you can lay down in the ground. So when you lay down, before, always remember, try to see your chin is below your forehead. If your chin is high up like this, you get a little sympathetic. So if you cannot, if you're comfortable, put a little pillow underneath that. The first you do, you start relaxing. The best relaxation is separate both the feet, like a width of the mat. Put your hand on the both sides, palm facing high up. And breathe out longer than breathing in. Then bring a visualization. Visualize your breath. Visualize your breath coming in through your nostril. When breath is coming through your nostril, the air gets purified. It filters the air. Nostril is like your personal air conditioner. If outside air is warm, it's going to cool it down. If it is cold, it's going to warm it up. Air then goes on the side of the nostril called turbinates, which directs the air towards your larynx, so all the air goes to the lung. If you breathe through your mouth, you don't know where the air has gone, whether it's stomach or in the lung. When the air is going through your mucosa of your sinuses, it secretes a substance called nitric oxide. Nitric oxide is a potent vasodilator. Nitric oxide then acts on your endothelial cells, inner lining of a blood vessel. It causes endothelial relaxation. It secretes a substance called your cyclic GMP and acetylcholine, which are transmitters of the parasympathetic tone. For a physician, as you know, epinephrine and norepinephrine is a mediator of sympathetic tone. Nitric oxide, cyclic GMP Acetylcholine is transmitters of your parasympathetic tone. You can put your one hand on your belly button, and then when you breathe in, stomach wall will rise. When you breathe out, stomach wall will come down. Breathe in. Breathe out. Breathe in. Breathe out. You continue for a few times and you'll find a profound level of relaxation. Then you visualize your breath is carrying the prana inside you. In yogic tradition, your whole body does breathing. Visualize your prana is going to the organ of breathing. In yogic tradition, your skin does breathing, your liver does breathing, your heart does breathing, not only your lung. Visualize that prana is going to the organ of healing. And this time, the gastrointestinal system is doing your healing. It's a wonderful relaxation technique. Use it even when you are sleeping. Like, a good call it dreamless sleep is a part of our digestive process. You sleep like this, called this a supta baddha konasana. That's the way the baby sleeps. Put your feet together. Use the breathing out longer than breathing in. Practice little breath holding. I have shown all of them in the Dinacharya tradition. You can take a look at that video. Okay, you can see. Again, look at the 5 asanas, which I already have shown you before and before all the time, but really practice it, very important. First asana is Pada Uttanasana. Just raise the foot a little high up, 30-degree high up, not all the way high up. Then get into the Naukasana. Get your body high up and slowly get into your boat pose, Naukasana. And Naukasana, you see that you have that sthiti, you get a fasciculation. And longer in Naukasana, the fasciculation sets in. Pada Uttanasana, Naukasana, ignites your Jఠragni. Pavan Muktasana, bend your knees, hold your hands together, hold the knees, slowly bring your head high up, touch your nose to the knee. Many a time you can put your chin in front of your knee. For a normal practice, you stay here between 5 to 10 breaths. But I'm just showing you the technique and for you to continue at home. Markatasana, or also called Jఠr Parivartanasana. Markatasana is a monkey pose, that's where the monkey. And then Jఠr Parivartan, Jఠr means your stomach, Parivartan means your rotation, also called Merudanda Sanchalanasana. Hands on both sides. Look at your right hand and drop both the knees on the other side. There's a lot of ways to do it. You can do the feet together. You can separate your feet. You can even raise both the feet high up. But most important thing is able to stay in the pose. In fact, in a yoga therapy, every pose, every asana is a savasana. You don't need a savasana when you're practicing yoga therapy, because this is your savasana. You don't need any counter pose. You don't need any relaxation, because all of your asanas, so you're talking, you're breathing, totally effortless. Opposite side, hand on the side, and slowly drop your knees on the ground and look at the other side. In fact, you're so relaxed, you'll be able to even sleep in this asana. So just for the fun of it, you must have seen, you could raise both the feet high up, hands on both sides, look into your left hand and drop both the feet touching your right hand. Markatasana or Jఠr Parivartanasana, the advanced pose. You can do the same thing again, feet high up, Go all the way down on the other side and touch your other hand. A very important asana to ignite your Agni is called your Padmastikasana. Hold your own foot, right foot, bring it up and touch it to your forehead. Padmastikasana. Very nice. You can do it the opposite side again. Always remember the asana practice is the balancing asanas. Other foot, bring it up, touch it to your forehead. So relaxed, beautiful. In advance, you could hold both of them, bring it up, and touch it to your forehead. When you relax, you can easily do your, like a Sarvanga asana. You can do Padmasana, Sarvanga asana. You can do Halasana. You can do Sirsasana. These are all comes to the relaxation. It's not you're trying, it's coming to you. When you relax, very easily, you could do your, like a shoulder stand, Sarvanga asana. Put your right foot here. Take your left foot above it. See? Padmasana in a Sarvanga asana. I'm talking. I'm breathing. Oh, I'm so nothing. I'm just trying to make fun of it. Huh? I'm okay. Because it comes from your daily practice. Very important. And then when you get up also, very nice way of yogic way of getting up, laying down. What do? Slowly turn on your one side, bend your feet like a fetal position, put your hands on both sides. Breathe in and out. That's why yogis sleep. Yogis sleep both, right side and left side. I've explained to you, showed you. If you don't remember, just go back to my, again, Dinacharya. They will put your hands like this and sleep. On the right side, the left nostril opens up, left nostril cooling. You do it at the beginning of the sleep. And in the later part of the sleep, when body already inner core temperature comes down, you sleep on the left side. So right nostril opens up. There's a balance. You get upside down. Very, very important practice. These asanas to ignite your Agni Dipana. Supta Baddha Konasana. Feet together, laying down. That is for your sleep. Supta Baddha Konasana with your Abhyantarin Kumbhak, breath holding. What the breath holding does, it increases your carbon dioxide inside your body, called CO2 narcosis. I don't know if you're hearing this. There's a lot of people are complaining about the mask now. It says when you're wearing the mask, after a long time, they're feeling drowsy. They said you're breathing in their own carbon dioxide. And in medical physiological terms, it's called the CO2 narcosis. CO2 is carbon dioxide. Carbon dioxide causes the narcotic effect. Nice way to fall asleep. People all say that I need all these asanas, this thing, that thing, doing asana. No. You have created a relaxation response. Okay, let's do a few asanas for proper elimination. Then we'll do a little pranayama practice to improve your GI function, gastrointestinal function. Then we talk a little bit about your concepts of yogic diet. Okay, so the first asana for your proper elimination, we have shown it to you, called Malasana. Able to sit down in a squatted position. Malasana will help you in proper elimination. Little bit more advanced in Malasana, it is called your Udarkarshanasana. And The way to do it, put your hands on the knees. Take the right knee in front of your left foot. Left hand on your left knee. Push the left knee towards the right side. Keep your spine straight. Take a deep breath in. Slowly turn your body to the opposite side. Udarkarshanasana. And slowly come back. Balance it. Opposite side. Left knee comes in front of your right foot. Right knee. You push your right knee to the other side. Keep spine straight. Deep breath in. Turn your body to the opposite side. You can look at my book. My book has all these asanas called Shankha Prakshalan. Shankha is like a conch shell. It's a metaphor of your intestine. Prakshalan is the cleaning your intestine. First asana, Udarkarshanasana, or called a Shankasana. Second is called your Tirjak Bhujangasana. Oblique cobra pose, laying down. Like you do a cobra pose, like so here you're laying down, you're getting a cobra pose. There's a lot of cobra pose called Bhujangasana. We call it a baby cobra. You can like put your hand here and slowly get up. See how far you can come up in a Bhujangasana. But the Tirjak Bhujangasana is a part of your Shankha Prakshalan. Separate your feet up to the width of the mat. Put your hand on both sides. Slowly get up into a Bhujangasana. And then turn your neck over the left shoulder towards looking at your right foot. It massages all of your intestinal contents and helps proper elimination. The name, again, Sanskrit name, Tirjak Bhujangasana, English translation, oblique cobra pose. Get high up again and look the other side. And so come back slowly. Two asanas, huh? Number 3, 4, 5 asanas are standing asanas. You stand up. Remember, standing up, the very important asana for improving your body's function is called a sit-rise test. What you do, you're able to sit down. If you're doing with me, see if you can try. It is not that difficult. You sit down in a squatting pose and you get up from squatting pose without a support. This is called actually your sign of your health. If you cannot get up, if you put a one hand, you lose 25% of your life. Two hands, lose 50%. You can always balance yourself, like you cross your feet. So remember one thing, we're comfortable standing like this, separation. So going against the grain of your habit, called the law of opposite, is yoga. Cross your feet. So if you can slowly come down and slowly get high up. This only comes from relaxation and helps you in your digestive process. Cross opposite side. Go down, go high up. When you activate the intuitive side of your brain, analytical side of the brain. Third asana. Utthita Tadasana, upward mountain pose. Put your feet together, hands high up, clasp your hand, relax, turn around, put over your head. You will breathe out first, take a deep breath in, and slowly get up on your tippy toes and hand on the side. And we'll continue breathing. Please do not hold your breath. Breathe in and out. Utthita Tadasana, upward mountain pose. Third pose. Fourth pose is your oblique mountain pose. Tirjak Tadasana. You can raise your hand all the way high up, Or you can take your one hand, hold your one arm, take your other hand, hold your other arm, and put it over your head. And breathe out first. Take a deep breath in and slowly turn your body on one side. Always remember, always keep your eye, try to do the eyes closed and breathing. Breathing out longer than breathing in. Come back high up. Breathe out first. Take a deep breath in and slowly go down on the other side. Number 4 asana. Come back in the middle. In a Purna Shankha Prakshalan, like a full intestinal cleansing, you keep on drinking 2 glasses of water, preferably a little saline water, and then do the 5 asanas. Initially, you have no bowel movement. Then you drink another 2 glasses to another 5 asanas. Keep on drinking 2 glasses to the 5 asanas, and within a 30 to 40 minutes, you have a bowel movement. Initially, you have a bowel movement, and slowly, you start having some even clear water comes out. Very important intestinal cleansing. Before I do the 5th one, just give you a little updates. One of my friend, probably he's looking at me now, Vijay, he's a gastroenterologist. He wrote a paper, and here's a product to this and a colonoscopy. Colonoscopy is a very simple procedure, but the preparation is a disastrous. So one of his patients told him one day, hey, I don't need any preparation. I'll prepare myself. So the person prepared herself or himself and came to the colonoscopy and found absolutely clean when he did a colonoscopy. So what did you do? He said, I'm a yoga practitioner. I did the Shankha Prakshalan to clean my colon, or the whole intestine. And he has done, Vijay has done a lot of GI studies, and he has he's a master in this, and he has shown it really helps even for a preparation of colonoscopy. The 5th one is called a Cody Chakra asana. Kati means west, chakra means turning around, the Cody Chakra asana. Best way to do it, put your hands in front, you breathe out first, take a deep breath in, and slowly turn your body on the opposite side, almost to your back. And the same breathing cycle, you come back in the middle. Cody Chakra asana. Again, breathe in the middle. Look all the way to the back without. You can look all the way to the back. And the same breathing cycle, you come back in the middle. This is such a relaxation practice. This is called a moving meditation. What you can do also, if you're practicing with me, close your eyes. See if you can do it with breathing. Close your eyes, follow your breath. Breathe out first. Take a deep breath in. And slowly go to one side. And come back to the other side. Breathe in here. Go all the way to the one side. Wonderful practice, huh? You also can do with a hand in the back. Like you take the left hand to the back, use the right hand over your left shoulder. Breathe out first. Take a deep breath in. And slowly turn your body all the way to the back. And slowly come back in the middle. Same way to the opposite side. Right hand to the back. Left hand over your right shoulder. Breathe out first. Take a deep breath in. Look all the way to the back without turning your shoulder. Beautiful practice, huh? 5 asanas for proper elimination. Shankha Praksalan. 5 or 6 asanas, laying down for igniting your Jataragni, your Vajrasana after food, and an empty stomach. It will be your Mundukasana. So after the asana, what happens? Your body gets very relaxed. You feel like your body is fluid. You can move your body any way you want. Huh? Pranayama. Pranayam. Prana is your life force. It's a subtle energy. It's a non-measurable energy. Putative energy. Huh? Breath brings it. It's like electricity. Breath is like electric cable. It brings the prana. Yam, control and restrain. So requirement of pranayama is that, again, Merudanda Achal Manasthir. Sit on a chair, it's very good for pranayama. Or put your back against a wall, very good practice for your pranayama. Lung is like a balloon, so you have done it already. We practice, we're not going to repeat again. We did at the beginning. Breathing out longer than breathing in. And slowly you increase your exhalation, because exhalation is your parasympathetic and inhalation is your sympathetic. Very important concept. Huh? We did count of 2 in, count of 4 out, count of 4 in, count of 8 out. So that is your first pranayama. Exhalation longer than inhalation. Second pranayama, very important, which you also have done, Mucha Pranayama. Breath holding in inhalation. And drop your chin down, touch your chin to the chest and hold. It stimulates your vagus nerve. Remember, for the vagus nerve, 80% is afferent. That afferent means going towards your brain. For vagus nerve, it going through the brain stem. And 20% is the efferent. Efferent is like a motor, it's coming out. So sensory is more than your motor function of the vagus nerve. Again, we showed you, we did a Valsalva maneuver, closing your laryngeal and pharyngeal sphincter. You can do Ujjayi Pranayama, but we'll do a little later. Bhastrika, the way you do the slow Bhastrika Pranayama, you can breathe in and breathe out. When you do breathe out, put your hands down. Active inhalation, active exhalation. Don't do a very rapid Bhastrika. Rapid Bhastrika sometimes creates a little sympathetic activation. It's called a Pranopradhan Pranayama. It brings your prana to your body. The most important pranayama is your Kapal Bhati Pranayama. Kapal is the forehead, Bhati is the shining. So you have one balloon here, diaphragm here, another balloon here. You bring your consciousness to your belly button, push your belly button to the back, and it hits your diaphragm, hits your lung, air comes out through your nose. It's a closed system. Active exhalation. You don't do any inhalation. Inhalation is a passive, and we inhale without knowing. Why? The day you born, nobody taught you how to breathe in. You breathe in on your own. So, again, comfortably sit down. I'm sitting in a nice Sukhasana. You can sit Sukhasana, Siddhasana, Ardha Padmasana, Padmasana. These are all relaxing asanas. We'll use hand mudras. What we'll do, we'll continue a set of Kapal Bhati Pranayama, very slow, 1 per second. And for yoga teachers, slow Kapal Bhati is a pranayama. Rapid Kapal Bhati is a kriya. There are Shat Kriyas. One of the Kriyas is a Kapal Bhati, before Nauli. So when you do it very rapidly, it's your Kriya. But also when you do rapidly, it is your effortless breathing. We'll do this mudra. It's called a Gana Mudra, Dhyana Mudra. Pin index finger down, called a Vayu Mudra. This improves your Vata function, controls your pain. Touch your middle finger. It's called a Shunya Mudra. It improves your hearing. Touch your ring finger, called Prithvi Mudra. It's a grounding. It helps your diabetes, obesity, truncal obesity. Touch your little finger, controls your body fluid, your bladder function, body fluid, skin perfusion. Touch your ring finger, little finger and thumb, Shakti Mudra, Prana Mudra, improves your strength. Middle finger, ring finger and thumb, called Apana Mudra. Apana Mudra is your elimination mudra, called a Pachan Mudra. Bring index finger down. This is called Apana Vayu Mudra or a Hridaya Mudra. So many mudras in the hand. I have shown it to you before and before. Vyana Mudra, Udana Mudra, a Linga Mudra, a Ganesh Mudra, the Hakini Mudra, your Shankha Mudra, your Dhenu Mudra. So these are all I can do it, with my eyes closed. Take a look at my mudra as an acupressure. Okay. Use your Dhyana Mudra, put it over there. We'll do 20 counts in each mudras. You keep on doing it, and I'll tell you the benefit of this pranayama. Okay? Close your eyes, breathe out first, and if you're new to it, and if you don't know how to do it, look at me. If just only belly button goes in, yeah, it comes out. Nothing is in between. Okay? Now, if you cannot do it, try doing try to do a little coughing. Okay? Then try to do it with the mouth closed. That's your Kapal Bhati Pranayama. Nothing moves. Chest doesn't move, body doesn't move. And I'll tell you how it works, benefit. It is Bhati means you have a tejas. It ignites your Agni. So look like you are glowing, like Kapal, forehead. Bhati means there is a light around you. It's called Kapal Bhati Pranayama. Start 1 per second, belly button to the back. Bring the index finger down to the top, and you keep doing it. Let me tell you the benefit. Massages your abdominal organs. Massages your liver. Massages your stomach. Massages your spleen. Massages your pancreas. Massages your small intestine. Massages your large intestine. For the female, it massages your uterus. Massages your tubes. Massages your ovaries. For the men, it massages your prostate. Change the mudra, Shunya Mudra, middle finger and thumb. Massages your diaphragm. Massages your lung. So I'm not breathing in. If you look at me, or if you can follow me, I'm doing this and I'm breathing in between without knowing. Active exhalation, passive inhalation. Ring finger and thumb, Prithvi Mudra. This is for diabetes and obesity. When you have a truncal obesity, diabetes, you do Kapal Bhati Pranayama with the Prithvi Mudra. Massaging your pancreas, massaging all the intestinal organs, and massaging it very clearly because you're already relaxed. Again and again, I'm to tell you for the yoga teachers, please do not do this thing at the beginning without creating a relaxation response. It doesn't work then. Massaging your lung, so all the air coming out through your nose. Between the lung, there is an organ called heart. It is also massaging the heart from the bottom. When you massage an organ, the organ gets better. Like for us, when somebody stops their heart, we do external chest compression called a CPR, cardiopulmonary resuscitation. But when you're doing this very gently, Kapal Bhati Pranayama, you're also massaging your heart. Little finger and thumb, Varun Mudra, to improve your bladder function, improve your circulatory function, perfusion of your skin. It makes you really looks a little better and better for the skin blood flow. When it massages your heart, massage it so slowly, very, very effective for people with cardiovascular disorder. We call it like an internal CPR. It's internal cardiopulmonary resuscitation. All the trapped carbon dioxide and all the toxic material in the lung is coming out because of active exhalation. All the toxins are coming out, fresh oxygen is coming in. Little finger, ring finger and thumb. I always do this pranayama daily and with my eyes closed. When the eyes closed, you feel a lot better and better. When the carbon dioxide is removed, oxygen comes in, you get aerobic glycolysis. The final product of your digestion is a glucose. Glucose combines with oxygen, forms carbon dioxide, water, and ATP. ATP is adenosine triphosphate, it's energy. Water comes out through your kidney, carbon dioxide comes out to your lung. Body has energy, which are catabolic, metabolic, anabolic energy. In Ayurvedic tradition, it's called the Vata, Pitta, and Kapha, the energy in your body. Middle finger, ring finger, and thumb, Apna Mudra. So what happens, the mudras are also your connector for your prana to go to the organ of healing. So mudras directs your prana. Pranayama controls your prana, controls and restrains your prana. Combining mudras with the Kapal Bhati Pranayama, you get a double effect of it. Very powerful therapy. You could do all the mudras. This is the Hriday Mudra. And a lot of people does, I know a friend of mine who just climbs the stairs. He does about 10, 12, 13 steps in the morning. He goes with the Hriday Mudra. Hriday Mudra controls your function. Linga Mudra is a very important mudra. For the babies, you'll see, they'll clasp a hand, they'll put the feet out. This is like a Linga Mudra. Look at all the mudras. Kapal Bhati Pranayama ignites your Jatharagni. It is very important for your gastrointestinal disorders. Udyani Bandh is your abdominal lock. So the three locks, first we did one called a chin lock, putting your chin to chest. Here, it will be your breathing out first. Take a deep breath in and completely breathe out. Suck your stomach in and hold. When you suck your stomach in and hold, it increases your negative intra-abdominal pressure. When it increases your negative intra-abdominal pressure, there is a better perfusion of the organ. Like we have a term in Ayurveda called Agni. Agni, we call a digestive fire. A lot of Western physicians ask what Agni. To me, Agni is a proper perfusion, proper innervation, proper functioning of an organ, as simple as it is. So try again, relaxation, Adhi Mudra, thumb inside and close over your knees. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. There's a breath holding in exhalation. A profound sense of relaxation. You can do the same. Then you want to relax, you massage your abdominal organs. It's called Agnisar Kriya. Very important for people with diabetes, the truncal obesity. So let me show you one time. You were able to do it with me or able to do it at home. So the way you to do it first, you breathe out first, and you'll see your stomach will be moving back and forth, stomach wall. So breathing out first, a deep breath in, completely breathe out. It's hard to show your body. If you see in my book, I have a book, and I've shown all the pictures of how to do the Agnisar Kriya. Agni is your Jathar Agni, the digestive fire. Sara is the essence. Sara, you can get the people in India and Bangladesh know when you warm a milk, we say in Bengali called shor poreche, shor, the essence. This is the essence of your Agni. Breathe out first. Deep breath in. Completely breathe out. Very powerful activation of your Agni and your parasympathetic activation. Mula Bandh, root lock. Contract your pelvic muscle, contract your anal sphincter, pull it up, hold it. It's like a Western medicine called a Kegel maneuver, K-E-G-L, Kegel maneuver. So same way, you breathe out first. Take a deep breath in. Completely breathe out. Contract your pelvic floor and pull it up. Wonderful practice. You can do all the three bandhas together. Maha Bandh, we also call it Mucha Pranayama. Vajra means external, breath holding and exhalation. Breathe out. Again, always do hand mudras when you're practicing. In fact, all the asanas you do with the hand mudras, you need to see how relaxed you feel. Breathe out first. Deep breath in. Sorry. Completely breathe out. Suck your stomach in and hold. Contract your pelvic floor and pull it up. Drop your chin down, the chin to the chest. And stay here as long as you can. Mahabandh, Gretlock. So whole quieting down your whole body and mind is your alternate nostril breathing on Ulum Vilom Pranayam. And then it's called meditative alternate nostril breathing. Doing alternate nostril breathing without doing your closing your nostril. Also to cool down your whole body. Cooling down is very important for your GI work. It's called Sitali Pranayama. The way to the Sitali Pranayama. Remember, you never breathe through your mouth. You always breathe through your nose. And somebody says, I have to breathe through my mouth. What you can do, you breathe through your nose and breathe out through your mouth. More physiological. But only thing what I notice, when you breathe out through your mouth, you lose the function of your muscles of expiration. But in a Sitali or Sitkari Pranayama, you do the mouth to make it cool. So stick your tongue out, breathe through your rolled tongue, breathe out through your nostril. If you can keep your tongue out rolled, you can breathe through your teeth, called Sitkari Pranayama. Lot of Ujjayi Pranayama. Contract your larynx and try to breathe in. I've shown you all in pranayama practice. This also, stimulates your vagus nerve. So in the left hand, first you do a Henna Mudra. Right hand, close your right nostril. You don't have to close all the way down, just underneath your nostril. Breathe out through your left nostril. Breathe in through your left nostril. Drop your ring finger, little finger down. Close your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. If you're practicing with me, keep practicing and let me tell you the stages, how to bring the meditative alternate nostril breathing to quiet down your gastrointestinal system. And slowly you bring your index finger and middle finger in between your eyebrows. Close your eyes, bring your focus here, called Vishnu Mudra. Take your left hand, hold your right earlobe. It balances both sides of your brain. Then with the eyes closed focus, you do your alternate nostril breathing. We continue as long as we can without any effort. And normally in our practice, we do 25 minutes of asanas, 25 minutes of pranayamas, 10 minutes of meditation, do generally 5 to 10 minutes of alternate nostril breathing. Many a time what you can do, you can do the opposite, holding other earlobe and bring the balance back. A meditative alternate nostril breathing is that bring your awareness to your body and mind, like when you are totally connected to the body and mind, when your body and mind unites. Remember, yoga means union body, mind, and spirit. Eyes closed, you can touch anything. We can touch your nostril, I can touch the top of my head, I'm touching my right great toe, I'm touching my left foot. In fact, I can visualize that I'm doing a class in the yoga studio in Sattik space. I'm entering the Sattik space door. I'm removing my shoes. I'm putting my mat. I'm sitting there clearly. So this is called your subtle body. So in the subtle body, again, just touch your index finger and thumb, close your eyes, and visualize you are breathing out through your left nostril. Visualize you are breathing in through your left nostril. Visualize you are breathing out through your right nostril. Visualize you are breathing in through your right nostril. Breathe out through your left nostril. Then the eyes closed. Slowly do your breathing, and this is you call meditative alternate nostril breathing. Let's do it a few minutes, which will be a meditation practice before we close and talk about concept of yogic diet. Slowly bring your both the hands in front of you. Touch your little finger and ring finger. Separate your little finger and thumb. Separate your ring finger, middle finger and index finger. Padma Mudra. Slowly bring the Padma Mudra in front of your heart chakra, Anahata chakra. Then bring it in front of your real heart. Heart is the site of your soul. Heart and mind is connected. Quiets down your mind. Padma Mudra connects our body, mind, and spirit. Slowly and slowly bring your hands again in front of your heart chakra. Bow your head down and you say Namaste. Namaste is a yogic way of saying, I honor the divinity within you. You are divine. Slowly finish with a nice pumping and cupping. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Take both the hands. Put it over your eyes. Take the eyes. Take all the heat from your hand. Massage your forehead. Massage your eyes, ears, the tragus, auricle, earlobe, the face, neck, carotid sinuses, massages. It's wonderful practice. Let's talk a little bit about the concept of a yogic diet. It's not that what you eat, what not to eat, because everybody eats all different food. The food, look at what the Russians eat. Look at what the Mexican eats. Look at what Chinese eat, Japanese eat, and you try to say it is your protein, fat, carbohydrate. No, yogis doesn't look the food that way. Yogis looks at the food that yoga says the food creates your mind. The word they use in Sanskrit is called yoga and Ayurveda. Jatha an tatha man creates your mind. We have three levels of your mind, or three states of our mind, called sattvic, rajasic, and tamasic. Just give me 1 minute. The batteries started going down. This really eats up the batteries all the time. Good thing I keep some batteries. Okay. The state of the mind is called sattvic, rajasic, and tamasic. Sattvic is the purity of your mind. Rajasic is the activity of your mind. Tamasic is the dullness of your mind. The food in Yoga and Ayurveda described as a sattvic food, rajasic food, and tamasic food. Food converts into your consciousness, and consciousness creates your all the body functions and cells, like sapta, dhatu, 7 tissues. So think about very rationally. My liver cells are dying every day. New liver cells are forming. Muscle cells are dying. Kidney cells are dying, called apoptosis. Do I eat a liver? Do I eat a kidney to improve the cells? No, I use a piece of bread, a piece of little rice, or a veggie, and that converts with a proper agni called dhatu agni, jathar agni. So the food, what Yoga and Ayurveda says, you eat a food with a 6 taste: astringent, bitter, pungent, salty, sour, sweet. And then you eat the food of 7 coloring fruits and vegetables: vibgyor, violet, indigo, blue, green, yellow, orange, red. You do only green, only yellow, all 7 coloring. Then you do intuitive eating. Your body knows what you're eating. We get a little carried away. We have our desires, our greed. Ayurveda says, eat little, mostly from the farm, little bit from the factory. That means fresh. Eat what your body needs without a desire or a greed. Wonderful statement, huh? So also the fruits and vegetables, they said you use your fresh, seasonal, local, and organic. Then on the dietary concept, what it says that we have 3 states of our being. So the 3 states we call rogi, nirogi, and a yogi. We are all rogi. Rogi means people who have an underlying disease. And in Yoga and Ayurveda, our body has 3 types called Vata, Pitta, and Kapha. We'll do one Ayurvedic yoga therapy. Maybe next one we'll do Ayurvedic yoga therapy, and you'll see what to do for Vata, to Pitta, and Kapha. Vata is a mobile energy. Their mind and body is very mobile, and their quality is attributes are very light. They're very dry. So the concept here is we have a Vata-related disorders. Vata-related disorders are primarily musculoskeletal disorders, bones and joints, and neuropsychiatric disorders. And Ayurveda says the law of opposite. We have a 6 taste: astringent, bitter, pungent, salty, sour, sweet. Astringent, bitter, pungent belongs to Vata. So when you have a Vata-related disorders, you eat food which opposing to the Vata test, like a salty, sour, sweet. You'll say food with a salty, sour, sweet. And we can give you a list of food. So we do not tell about the food because the food is very variant, it's a concept. So Pitta-related disorders are inflammatory disorders. Pitta are the heart, liver disorders. And Pitta-related disorder, Pitta is your pungent, salty, sour. So in Pitta disorder, you'll be eating astringent, bitter, and sweet. The word is called Rogir Pottu. Rogi means people with disease, Pottu means diet. People with disease have a diet. Kapha disorder, primary is very grounding, main attributes is your water. Pitta main attribute is fire. Vata main attribute is your air, mobile. Kapha is totally grounding, and their taste they like it, salty, sour, sweet. So Kapha disorders, like disorders of your the diabetes, obesity, disease with the fluid contents, kidney disease, congestive heart failures. So Kapha-related people will have a food which are astringent, bitter, and pungent. Rogir Potto, food based on your doshas, Ayurvedic body type. See, concepts. You have to take the concepts with you so you can adjust your diet. Second is on nirogi. Nirogi means people who are healthy, who have no disease. Nirogi practices Agni Deepana, ignites your Agni, ignite your Jataragni. We did all the practices. Activation of a vagus nerve, after proper relaxation, you do your Kapal Bhati Pranayama, you do your Udyani Bandha, Agnisar Kriya, Mundukasana, all here called Udarkarshan. The word is called Udarkarshan. Ignite your Agni. Our existence as a life now is called yogi and yogini. Yogi and yogini call it intuitive eating. What is intuitive eating? Your body knows what you're eating. I've seen so many yoga practitioners, they've been eating exactly intuitive eating, they don't know even. See, what happens in yoga practice is a sort of transformation. Today you're trying to touch your toes, you cannot. Slowly and slowly in stages, you're able to touch your toes. The moment you can touch your toes, your mind says, hey, I couldn't do it before. So let me see what I'm eating. Let me see what am I sleeping. Let me see what my elimination is. They start looking inside even without knowing. I've seen in yoga practitioners years and years, they'll go to a buffet, they will pick up an apple instead of a bagel. Why? The body knows. The day ate a bagel with the cream cheese, and with the apple, there was a difference. They pick up the food and looks like they have some vegetarian food. I'm sitting eating with them. I said, are you vegetarian? No, I'm not vegetarian. Why did you pick it? I don't know. So intuitive eating is called the body which knows what food to eat. How do you know what body to eat? A food when you eat or when you consume, generally in yoga Ayurvedic tradition is your lunch is the main meal. So morning is a kapha time, so you have a small breakfast. Pitta time is between 10 to 2 p.m., so lunch is the main meal. Dinner is very small because dinner is again a kapha time between 6 to 10. Dinner is about almost half the size of your lunch and about 3 or 4 hours, in fact 2 to 3, even 4 hours before going to sleep, because you need an empty stomach to sleep. So how do you know the food is good for your body or food is applicable for your body? Signs of digestion in Ayurveda. Lightness in the body and mind. When you feel lightness in the body and mind, the food is applicable for you. The moment you get a heaviness after eating, then you get a food coma. That food is not going to be digested. That food is going to be high cholesterol, high sugar, high anything in your body in the high, because it's an ama, undigested food. Lightness in the body and mind. Enthusiasm, proper, you feel good, nice after eating, very nice feeling. No smell in your excreta. Your excreta, your stool, your urine, your perspiration, they're excreta. Urine should not smell. Stool should not smell. Your perspiration doesn't smell. When you get a smell in excreta, that food was not part of your body. Food was not digested. Proper hunger and thirst. After about 3 to 6 hours of a main meal, you get hungry. If you're getting hungry before, it's not hunger, it's a thirst. Brain doesn't know how to separate your hunger and thirst. So when you feel hungry before appropriate time, drink little water. When you drink little water, if the hunger goes, it was thirst, it was not your hunger. Clear belch. Like after 2-3 hours or 4 hours of food, when you belch, when the air comes out through gastroesophageal sphincter, that should not have any smell. If that has a smell, that means your Agni is poor, you're not digesting properly. It is not your intuitive diet. Finally, it's called the appropriate natural urges. You have 13 natural urges: coughing, sneezing, yawning, breathing, like passing your urine, passing your stool. So 13 natural urges, take a look at all the urges, they'll be normal. And that is your intuitive eating. So the concept of yogic diet, as I said, diet is the Latin word, way of living. It's not I'm eating a piece of bread, I'm eating a piece of khichdi, I'm doing my monofast, I'm doing all these things are going to happen. The food will be digested only with parasympathetic activation. The moment you think the food is a calorie, I'm going to burn with the exercise, you're hurting yourself. In whole Western countries, everybody I know, high cholesterol, high sugar. And I have seen people even here, they're totally relaxed, totally comfortable, eating, all this cheesy, greasy, all the food stuff. Nothing happens, they're fine. And the intuitive eating is very important. And people also knows they're eating too much, Like, if you think about a calorie concept, we generally take 10 to 15 calories per pound. So generally, all the food level comes with the 2,000 calories per daily consumption. In the United States, the average consumption is 3,900 calories, twice the amount of calories. I can go on and on and on with the yogic concept of diet. Viruddha ahar, what to eat, what not to eat. But for the message for you to take home, that we have 3 levels of being, 3 levels of our existence. We call it rogi, people with disease. It's called rogir pottu. Rogir pottu means the diet of a diseased person. Based on your body type, vata, pitta, and kapha, the disease belongs to vata, we'll have a vata pacifying diet. This belongs to pitta, we'll have pitta pacifying diet. This belongs to kapha, will be the kapha pacifying diet. When you transform yourself to a nirogi, people with no disease and healthy, you will have all the practice to ignite your Jataragni. Agni Dipana, Ama Pachana, Nadi Shodhana, and Ojosthapana. Beautiful way of describing yogic concept of diet. Finally, when you transform into yogi and yogi, intuitive eating. Intuitive eating, your body knows what to eat. Lightness in the body and mind, enthusiasm, you're very nice, always is like a energizer battery. Your clear belch after 3-4 hours, no smells in your excreta, and proper and functioning natural urges. Thank you. I think we're just on time. Thank you for participating. So let's make a deal for next Saturday. We'll talk about Ayurvedic yoga therapy, the whole yoga therapy practice based on Ayurvedic philosophy. Thank you again for participating and joining. I see again, lots of comments and questions are here. And again, I said I cannot read and answer at the same time, but I'll be glad to answer all of them when I get a time and look at them. Okay? Goodbye. See you next Saturday.